suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa. Hello, everyone, and good afternoon, good morning, good evening, wherever you are in the whole wide world. I am Empressmawu here on the health segment on Trend Africa TV. I am going to be joined today by some very special guests, and it's very important for me to stress on special guests because these are professionals who are volunteering their time to educate the community on COVID-19 and the way forward. Without much ado, I would like to introduce Miss Eunice Cromwell. Eunice Cromwell, are you there? She's not there yet. Okay. So right now, I would like to plead with everyone to share the feed. We'll take a second break just to give everyone the chance to share the feed because the information we're going to be sharing today is very important for us to have a good crowd to listen to us because this is very important information about COVID. So we'll be right back. Don't touch that down.
Bang, bang, bang. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona. People dying every day. Corona. It be virus. Mania. Funny serious. Corona. Yeah, virus. Chewa. You go lost.
Purchase your track now.
Wash your hand daily with running water and don't stop. Keep away from non-farm meetings and do something, bro. Pray for your enemy, pray for your family, pray for your country, yeah. Don't forget to keep clean with hand sanitizer. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona. People dying every day. Corona. It be virus. Mania. Funny serious. Corona. Yeah, virus. Chewa. We go lost. China, Japan, man down. Italy, UK, man down. United States locked down. What now? Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona. People dying every day. Corona. It be virus. Mania. Funny serious. Corona. Yeah, virus. Chewa. We go lost. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona. People dying every day. Corona. It be virus. Mania. Funny serious. Corona. Yeah, virus. Chewa. We go lost.
Hello, everyone. Again, this is Empressmawu on the health segment on Trend Africa TV. I am being joined by my regular co-host, which are in the person of Mrs. Eunice Cromwell and Dr. Edward Ofori. Without much ado, I'd like to introduce them, and it's very important for me to always introduce them because for you to attain all this education and be here, volunteering your time for nothing, I mean, it's very important. The least we can do is, big them up, I would say. So Mrs. Eunice Cromwell is a family nurse practitioner who provides continuing and comprehensive health care for all ages and genders while emphasizing on disease prevention. She's also the financial manager of the Ghana National Council. Mrs. Eunice Cromwell, are you there?
I'm here.
Thanks for joining us.
More than welcome. Thank
I
you for
guess
having
today
me
you are
again.
not gracing the screen with your beautiful face again today, right?
Oh, maybe later on I'll be there. Oh.
You know, I don't know what's up with you, man. We need to talk later. Okay.
Hi, Dr. Ofori. How are you?
I'm
Nice to see
good.
you.
Nice
Good,
to see you too.
good, good, good.
Thank you. Dr. Edward Ofori is also an assistant professor of the pharmaceutical sciences at the Chicago State College of Pharmacy. He's a professional pharmacist and a researcher in mental health and neuropsychiatry. Dr. Edward Ofori, thanks for joining us.
Thank you. Nice to be
Okay,
here.
so now we would like to give Mrs. Eunice Cromwell the platform. Mrs. Eunice, can you please update us on coronavirus and what phase we are in right now in Illinois?
We're in phase three. I'm sorry, phase four. But I've been hearing a lot of things on the news that they're thinking about bringing us back to phase three. And I think one of the most alarming things that I heard on the news just before on CNN is that they're saying that there's a lot more cases that are coming. They spoke they were very concerned about Florida and Texas especially. So I think that overall, although we've been doing everything that we can with social distancing and wearing our mask and everything, I think people are getting very tired of it and people are more relaxing. And because a lot of people don't really believe that the virus can really affect them, we're seeing more of cases come up and there's more deaths coming up. So, a very uncertain time that we're in right now. I know that in Ghana, they are still closing all the borders, and it's just very scary because now even taking your kids to school. I also heard that Illinois was closing down all leagues. So, like basketball leagues, soccer leagues for the kids. And some parents were actually moving their kids to other states just so they could still play sports. So, it's very uncertain right now. I think that we were doing good at one time, but unfortunately, everything is kind of going backwards. And people are saying that there's a second wave of coronavirus, but I beg to differ, and I think that the first one never really went away. I think it was just kind of like in remission. But as we stopped really caring about all the things that were advised by the CDC, it's just back. I mean, it's here and it's bigger than ever. So, very, very unfortunate.
How are your patients doing? Are you there? I guess we've lost Mrs. Cromwell. Dr. Ofori, are you there? Dr. Ofori.
Yes, I can hear you.
Okay, so can you give us any updates in terms of treatments concerning coronavirus?
Yes. So the good news is that at least we have one of the vaccines enter into phase four clinical trials. I should say phase three, and that's very it's a groundbreaking thing because it's giving us an opportunity to have something in a larger population to see if it's gonna provide any kind of immunity for people if they are given the vaccine. One other thing that I would say is that we also having some resurfaced videos about people talking about hydroxychloroquine in the media, and we're going to talk about it today more into details. But we don't have any kind of treatment options in terms of like what we call small molecules. But we do have something in place, and there's a couple more coming up in terms of vaccines in development. So that's all that I have for now.
So Fori, I would like we will now go ahead and introduce our special guest for today, and we are blessed to have two special guests, and we are very grateful for their time. I'm going to first introduce Dr. I want to get the name right, so Zambrano.
You got it.
Yeah.
Doc- Dr. Zambrano, how you doing today?
Good, good, good. Thank you. I'm
So,
good.
um, Dr. Zam, I want the viewers to know how important your role is. So, would you please introduce yourself to our viewers?
Thank you. So I'm Carlos Zambrano. I'm one infectious disease doctor in Chicago, and I don't know what I'm a special guest. And my work, I work with Levet at the Loreto Hospital in Chicago.
Okay.
We take care of patients there. So we communicate a lot and try to be, so much information, especially at the beginning. Every day something new coming up. We didn't know what to do, trying this, trying the other. Vitamins, vitamin D, ascorbic acid, Pepsid, famotidine, and you name it, throwing in the hydroxychloroquine at the beginning, and then going to the other medications, the remdesivir, convalescent plasma, aspirin, and anticoagulation guidelines. So we did it all. We had some success, some failures, and thanks God, things are slowing down now. So we're taking a breather, and knocking wood, uh, in August, September, hopefully the number of cases is not going to go as high as it was in back in April and May, because we were overwhelmed with the number of cases to be ruled out, and the positive ones too.
About things are dying down in the hospitals. However, I work in the hospital too, and I see things are dying down. Last night we had only one COVID patient, but then they're saying Fauci was saying on CNN today that there's the surge is getting to the Midwest right now. But how come it looks like people are not checking into the hospitals anymore? Is that what the problem is?
Yeah, so for the very same reasons, and also the pressure from the neighboring states, having so many cases that spill over, and people traveling from our state to all neighboring states, or from the other states to here. So eventually, we're all gonna get into the mix of having a high burden of cases.
Without much ado, I'd like to let's bring in um Dr. Lovett Owusu. Are you there? Are you there, Dr. Lovett Owusu? Okay. Um, we've lost her for now, so we'll just go on with the conversation. Dr. Ofori, over to you. You have questions for Dr.
Yes. So we wanted to. A lot of people still believe that COVID is not a bacteria. It's not a viral infection. It's some kind of a bacterial infection. Can you tell? I mean, or explain to our listeners like why we should be educated on what the pathophysiology of the disease is.
Yeah. So these the coronaviruses, they've been around for many, many years, for sure hundreds of years, but very likely thousands of years. And so throughout the history, there were waves of coronaviruses being very aggressive. And once the population started getting immune, so they would get very, very mild. So of late, the coronaviruses were all mild, causing just a common cold. In our respiratory vital panel at any hospital, we usually run four coronaviruses that are very common, and they usually cause very mild disease. So I'm running all those things like that. Not until 2003, when SARS coronavirus was a new coronavirus, came in as a mutation from animal to human through the bats in China, and then more recently the MERS also came as a new coronavirus from the camels to humans through the bats, when two coronaviruses mutated and infected a human, and from then human to human transmission. So we have seen this movie before. Coronaviruses we're very familiar with them. Exactly how they the transmission from person to person, the droplets, and some of them through aerosols, through fomites with the surfaces getting contaminated. We touching our faces and our noses and rubbing our eyes and contaminating ourselves. And so all these things we knew from for a long time. And so now these new mutation came in, and initially there were some theories that the virus was as human made. In the lab in China, somebody just created a different virus. But looking at at the genetics of the virus and how they trace it to the original viruses that are got together and mutated, and to the pangolins, the intermediate host, the animal that got contaminated initially, they were able to trace that this is a coronavirus and just evolving into mutated into a novel coronavirus and causing similar disease that other aggressive coronavirus had caused in the past. So it is this. We've seen this movie. There's nothing unusual about it, and we know it causes an excess of immune response. And there are some differences, though, in between the SARS and the MERS and these COVID-19 or SARS-2 coronavirus. And this one has unique features causing all those blood clots and being more aggressive in attaching to the ACE receptors, and all the problems that we've seen that are being in bodily fluids, something that we didn't see with the SARS and the MERS. They were more respiratory viruses. So some differences, but for the most part, we've seen this movie before. And
yeah. All right. Thank you. So the other question that a lot of people ask is, so there's one disease that has so many different outcomes, I should say, like different mild, severe, very severe. Why is it so?
Yeah, that's a great question. So we know it is affecting more men than women. And apparently there are some mutations in the X chromosome in men. So men have one X and one Y chromosome, and the female two X chromosomes. And apparently if you have a mutation on your X chromosome, then and your immunity is going to be as good. Females, they may have a mutation in one X chromosome, but the other one may be working fine. So we've seen that apparently men have some deficiency in the interferon. Also, they have seen mutations in the ACE receptors, that some people have more ACE receptors than others, or more susceptible to the virus attaching to those receptors. So there are many individual differences in how the amount of viruses you're going to get and how much disease you're going to be getting. So that's been very interesting. Now, the virus, the other two coronaviruses that were aggressive, mainly respiratory, this one affects the entire body. So some people get more GI symptoms or only GI symptoms. Most people get only respiratory symptoms, and some other people get other symptoms. There are now, as the time goes by, initially we started with the fever, cough, and difficulty in breathing, and then the list grew to 11 symptoms, now 20 or more that you can develop, and it varies. Each person gets more of these, more of the other.
All right. So the tying up to that question, does it mean that the treatment that we will look for in the future will have to be tailored to the different types of patient groups that we have?
I think the treatment is gonna be very similar. Just attacking the virus, trying to stop the replication, the virus from multiplying. And so all those medications they're looking for, there are a bunch of medications, at least 30 medications they are under study, because they decrease the replication or stop the viral replication. All the other problems that the virus is causing. So there are some treatments patients are getting for the blood clots and all the other things. a new inhaler in the UK with interferon to replace the lack of interferon. They are using an inhaler twice a day, and that is apparently relieving some of the respiratory symptoms. Remdesivir is an antiviral medication, and the convalescent plasma IgG antibodies to fight the virus off. So I think the medications, regardless of where the virus is, organ system is affecting the most, all the medications are going to try to either attack the virus to stop replicating or stop the immune response from being too strong to fight
Right.
the virus off.
Right. So there was a new study about use of steroids, and I think one of them was dexamethasone in treating patients. Do you use that in your practice?
Yeah, initially the WHO had claimed that we shouldn't be using steroids in COVID-19 because historically in sepsis, the steroids had increased the overall mortality, especially in ICU patients, intubated patients with the ARDS. So, and then initially they recommended not to use the steroids, but then later on, everybody started seeing that it wasn't only for COPD and asthma patients. Many other patients were getting better with some steroids. So they changed the guidelines, and we started using the Decadron with some benefits. It is not a miracle drug, by any chance, but it's something that most people are using now.
Okay. All right. So since we're talking about medications, so what about hydroxychloroquine? How critical, how is it in your protocols for treatment of COVID in the hospital?
Yeah, so there were many medications that they had some activity against the virus in stopping replication, and many of them. And so in China, they had seen anecdotal experience that had people taking hydroxychloroquine were getting better, had a milder disease, and they were getting out of the hospital better. And then they published some case studies with a few number of people that they were, to back that up, but there were no randomized placebo-controlled studies. So with only that information, since we had no other medications to use, everybody started using hydroxychloroquine because it's a medication everybody was familiar with. We've been using it for years, 40 years, for other reasons, lupus and arthritis and things like that. So we started using a lot of that, and we really didn't see much improvement. And then little by little, well-done studies, randomized, placebo-controlled, stated that there was no benefit of either using hydroxychloroquine, azithromycin, or the combination of the two. And in some cases, we were running the risk of having a QT prolongation because both of those medications could cause QT prolongation.
Right. So there's a lot of debate about whether we should consider using hydroxychloroquine, because other countries have hydroxychloroquine in their protocols and they're still using it. So I mean, I don't know if there's a controversial video out there about other medics claiming that it actually works, and that we are trying to hide it from other people. What is your comment on that?
Yeah, it doesn't. I mean, that is not following the science, because there are good placebo-controlled studies now out there that are the results are unequivocal that hydroxychloroquine is not working for COVID-19, and so and not until those studies that are gonna be showing something different, we
Right.
cannot. So far, all the evidence is pointing towards it doesn't work. The initial evidence was just anecdotal and only a few number of cases, and those case studies were published, but there were no randomized studies. And now we have randomized studies showing there is no, and that is the standard of care. So the standard of care right now is the hydroxychloroquine doesn't work for COVID-19.
Okay. Eunice, you have any questions? Hello, Eunice? Okay.
Yes, I'm sorry. Can you hear me? I was on mute.
Oh yeah.
Okay, sorry. Yes, I do have a couple questions. My first question is, Doctor, you mentioned about how this disease is presenting with blood clots and other thrombolytic diseases. So, would it be recommended to treat people with Plavix or Eliquis or those things? And then also, what happens for people who already have like viral diseases in them? Are they more affected by this virus?
The second question is about people who have other viral diseases.
Mm-hmm.
Yes.
Yeah, so the first question is about the blood clots. And in autopsies, they found in Italy and um, in the US, one of the main problems with this virus is causes endothelial damage inside the vessel, and uh, the coagulation cascade goes and causes blood clotting, and that is affecting all organ systems. So that's a big issue because we see patients coming in with D dimers extremely elevated. We didn't see before 20,000 or more, 30,000 levels and things like that. And so there are guidelines to put those patients on anticoagulation to try to avoid that. Um, so since we are not really familiar in how in the long is how long this is all these processes are gonna get, are you gonna get hypercoagulable state that is ongoing? Are the blood clots gonna be a problem for the future? Are you gonna be having a heart attack in 6 months or a stroke or things like that? So it is hard to have guidelines to say we're going to anticoagulate these people like if they had coronary artery disease or atherosclerotic disease. So far we're focused more on the acute phase of the COVID-19 illness, trying to avoid any major problems with clotting of the blood. And the second question is about in regards to other viruses, and then that's going to be a problem now for the winter when we see that there could be a synergy between the regular seasonal flu virus and now COVID-19. That's going to be a really hard if somebody gets both of them. Um, and so it is not going to be good. So we're going to have to be especially careful as the winter approaches because we cannot afford to, the healthcare system is going to be overwhelmed.
Yes, and then Doctor, you also were talking about the pathophysiology, and you mentioned how this one came from bats, that were in China. And my question is that you were talking about people to people contaminating themselves. So, are we saying that these people had close communication with these animals and they didn't wash their hands, and that's how it was transferred? Or are we saying that people who are eating these animals, and I'm asking this because there's been lots of debate and lots of memes and a lot of misinformation, and they show people eating all these different type of animals, and they are saying, they're telling people that they're the reasons why COVID-19 is here, which you already told us that it's just a mutation because coronavirus has been around for a long time. So could you just clarify that for the pathophysiology?
Yeah, so many of these viruses are zoonotic diseases. So are diseases that are being acquired, are being passed on to humans from animals. And in China is a prime example of how all these influenza viruses they are also zoonotic. The H1N1, the swine flu, zoonotic disease, and all these coronaviruses in the SARS and the MERS. Um, in the in the SARS, also an animal, a wild cat, and in the case of the MERS, the camel. So what happens is the bats they carry the coronaviruses, and they have a very strong immune system. They are able to fight these viruses off, and they modulate down modulate their immune system so not to get sick from the coronaviruses, and then from they transmit the viruses to the intermediate host. In this case, the COVID-19, the pangolin, and a mammal. So and if the humans are going to be manipulating the animals, getting contaminated with secretions, they are in the market. They are selling live animals, livestock in the markets, So people around are going to be contaminated. And then once it reaches humans, it is going to be human to human transmission. The virus has mutated. Two viruses, one in the bat, one in the intermediate host in the animal, and then now combine the two. A different virus is now affecting the human.
And my last question is just to explain to our viewers. A lot of people don't really know the differences with specialties. We've had a lot of other doctors come on that are primary care, OBGYN, and so forth. And so in your role as an infectious disease physician, what are you doing in terms of COVID-19? Are you doing research? Are you doing more medication-based? Can you explain to our viewers exactly your role when it comes to the
So we
COVID-19?
it's actually two roles in the hospital. We do the infection control piece, which is an advisory role to the hospital in regards to interpreting the CDC guidelines and putting all the policies and procedures together, or help to put those together, and doing the infection control piece, affecting the patients and the staff and all the hospital employees. And the other piece is doing the clinical piece with Levet and the pharmacy, and trying to develop the guidelines we're going to follow to treat the patients, and so it's the clinical piece. No research or any other, just the clinical and the infection control.
Thank you. Those are all my questions for now. I'll be back.
Okay, viewers, we are a little break and we'll be right back. Don't touch that dial.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live.
Charlie, this corona thing slow everything down, eh? When all this go end? Make a call Dr. Eunice say she gets some information.
Hey, hello, Adam. I hear from you, Chao. How be you and your family?
We all be cool, oh. I hope say you be fine too. I dey call ask some questions about coronavirus.
Sure. What things you want to know?
I hear say corona medicine dey wait them to hide them.
Me self, I hear, but it no be true. Plenty research they go on to find corona medicine, but this usually they take time. Researchers too, they try some of the old medicines, and some they show good promise. We for hope say the hard work will pay off soon.
So what about medicines where people they call immune boosters? Then they fit prevent or cure corona? How about if I take plenty vitamin C and D?
As with all infections, your immune system they help fight corona. You go fit take some food supplements support your immune system. But if you dey chop balanced diet, you dey get enough nutrients. No research they so say taking plenty supplements will protect you from corona. The medicines them they call immune boosters too. Nothing they show say them go protect you.
And what about vaccines?
Yeah, vaccines they help, but that usually be to protect people them no yet get the disease. Plenty research they go on to find corona vaccine, but this usually they take time. People self-start talk say vaccines no good, but that no be true. It be sake of vaccines where some diseases like polio no they worry we again. You know what? The vaccine matter there. I go take my time explain them later.
Oh, okay. So how we go protect one body from corona?
The best way be say you for day house as much as possible. But if you for come out, you for wear mask then day at least 2 meters from other people. You for make sure say the mask they cover your mouth, then nose all. You also for wash then sanitize your hands more times, then make you no touch your face. Take some bleach to sanitize your surfaces. If you feel say you get corona, you for quarantine yourself. You for rest plenty, chop well, then drink plenty fluids. But if you know they make better, then you for call the emergency numbers. If you get corona, it no they mean say you go die. More people they recover cry. Yeah. We all for follow these simple directions. So say we go protect we than other people from corona. And we no go overburden one of healthcare professionals than healthcare system.
Hey, Dr. Amina, that you shack rough.
Hey Adam, Sean that thing. Which madam then the kiddies give me.
Hello, Dr. Amina. How be?
Adeo, Adam, how be you too?
How we go do At the course sake of the other time you talk, say you go explain the vaccines thing give me.
Oh yeah, so everybody get immune system which they protect we from infections, right? Take say the body be house. The immune system be the house security, where viruses be arm robbers. If arm robbers come the house, where the security no make ready for them then yawa. So vaccines be what they train the security to recognize and fight these robbers if them come the house inside. Vaccines there, we start to use no be today If the vaccines help we fight the 6 childhood killer diseases safe.
So why people they talk say vaccines no good?
I tell you say it no be true. Vaccines be safe wah. Some people they react badly to vaccines, but that be rare cry.
Oh, for real? I never know say them be safe like that. But why them still no get corona vaccine?
Charlie Adam, making vaccines and medicines no be easy. It no day like tea bread where them they take one day do It they take time to make vaccines. Sometimes yes safe. This be because them for do plenty tests make sure say it a job. Where it be safe too.
But if it take years, why them say the corona one day we figure time soon?
Righty, research advance wah. So we go fit develop vaccines in much shorter time. Also, sake of corona make pandemic, everybody they put in extra work to get vaccine.
So why they won't try the corona vaccine for only Africans wanna talk?
The French doctors them talk that thing there. Them no force cry. Where what them talk self no be true. Vaccine trials they go on for UK, Yankee, and other places. Sake of how corona spread, it be best to test the vaccines for every continent. Otherwise, we no gonna know if it go work give we. In any case, wanna FDA for approve all trials before we go fit participate. So one thing we for do be say, before make wanna leaders do due diligence before them go accept anything.
Hey, Dr. Amina, I'm sorry. You make about this vaccine thing, pow.
Adam, a day for you. I be you the kind how you go protect your body from corona.
Oh yeah, at the Kaiwa, I will stay house if I don't get anywhere go. I will wear mask if I come out, wash and sanitize my hands and other surfaces, and I will try to stay 6 feet away from other people.
Hello, everyone, and welcome again to the health segment on Trend Africa TV. I am Empressmawu. We are here in Illinois. We are all the way here in Illinois, also called as the Windy City. I'm being joined by Mrs. Eunice Cromwell, Dr. Edward Ofori, Dr. Zambrano. Is Dr. Lovett back or she just totally vanished? Is she there? No, she's no more there. Okay, well, we'll give her a different a platform just for herself another week. So we thank them for all their time. Dr. Zambrano, are you there?
Correct, so far. Yes, they were notified. Mm-hmm.
Oh, okay. You can hear me?
Thank you, Dr. Patel. Appreciate it.
Oh, Dr. Zambrano. Okay, Dr. Zambrano is probably busy right now. Dr. Ofori. So
yes.
This video circulating of Dr. Stella Emmanuel, she claims she has been treating her patients with a combination of hydroxychloroquine, zinc, and azithromycin. And how misleading is this?
Yes, so this video has gone viral, as you and I know, and it's so interesting how we try to spread, our educational piece of information, and we don't even get thousands of people watching it. But then when you have people spreading false information, it goes around the whole world. What I will say about it is that people are kind of tired of coronavirus, and I understand. And therefore, they would like to believe anything else other than the truth, right? What the claims that she made in that video are very, I don't know, for some reason, I think it's politically motivated. I don't think we have any gain as a health profession to keep a treatment from people. And we have 150,000 people in the US dying. Millions of people around the world getting infected. There's no rationale to keep the treatment if it actually is effective from people. So what I will say out there is that, prevention is better than trying to cure any disease. So we should continue wearing the mask. As of June 28th, I looked at her Facebook and she had a mask on, right? So it clearly states that don't listen to that, because if you get sick, it's harder to treat than to prevent it. So let's wear the mask, observe all the CDC rules, and kind of try and sift all the information that you get. It's not everything that is for consumption, and I think one of it is what we just witnessed.
So, and then under what circumstance would that combination of medications be effective? We're talking about azithromycin. We're talking about hydrochloroquine, hydrochlorox.
Hydroxychloroquine. Yeah.
Thing. And under what circumstances would that combination be effective?
So as rightly Dr. Zambrano mentioned earlier on, right? So there was a little study that was done earlier on, and we started using it because at that point we didn't have any options, right? We've done better studies and realized it's not beneficial to a lot of people.
Okay.
Even though in other countries they still have it on their compendia and they still kind of have it as one of their protocols, right? It is least beneficial to a lot of the patients who are critically ill patients. So we assume that azithromycin in that combination was meant for bacteria infection that results from any kind of super infection as a result of the COVID disease. So that combination is still used elsewhere in other places, including even in Ghana. I'm not going to disregard the fact that that is possible, because you can have both bacterial infection at the same time. But then to claim that that is a cure is what I'm worried about. We can say zinc helps in one way or the other because it helps with our immune system. But that combination as a cure, I don't have any data to support that, and therefore I'm not going to go out there and claim that.
So she also talked about using chloroquine as prophylactically. How true is that, and what are the dangers of using chloroquine prophylactically?
Correct. So you remember Dr. Zambrano mentioned something about Q2 interval prolongation, right?
Yes.
So, and you and I are from Africa and other places where malaria is very endemic. And if you go back and you look at the treatment options we have there, it does not put hydroxychloroquine or chloroquine as first, right? We actually have better treatment options in Africa for malaria. There's a reason for it. If you remember when you were little, whenever you were sick and they gave you chloroquine, you saw how you reacted to it, right? Yeah, I mean, I can still remember that. So it's not the best option at this point. Besides the fact that we've done trials to see that it's not beneficial, you can actually have other consequences as a result of taking that prophylactically in terms of your heart, people with heart diseases. It can actually cause serious issues to patients. So I would advise that our listeners should not just go off of what people are saying, just a mere say with no data, no facts behind it. We should actually stick with what health professionals are saying. And you just don't have to self-medicate yourself, because I'm hearing back home in Ghana, it's even hard to find chloroquine or any kind of hydroxychloroquine for that purpose, because people already bought them and taking them just to, I don't know, it's not effective, and therefore we shouldn't do that.
Thank you. Dr. Zambrano, new study finds high viral load in young children, which is raising questions about how likely they are to transmit the virus. Did you recently hear about this new study?
Yeah, so it has been also a very hot topic to try to understand what role the younger kids are playing in the transmission and the spreading of these disease, this virus. It seems that the younger they are, the less likely they're going to transmit the virus. So now we see in Chicago, daycares are open. Apparently, they're doing okay. Not too many outbreaks in those settings. And then a little bigger kids also not having too much transmission. But there is a lot of transmission in the young population that is spreading the virus. It is true that the mortality rates is lower in the younger population. But we've seen very sick, we've seen reports of very sick children um, and teenagers after being affected with the virus. So the immune systems are not highly developed. Some people claim they don't have enough ACE receptors, and that's why they may be less prone to having a more severe disease. But anybody could transmit the virus. Anybody could get really sick. So I don't think we should be exposing the kids to this virus. And if they get infected, it's very likely they're gonna bring it home and bring it to the older, to their parents and grandparents, and most likely everybody at home is gonna get infected. So now with the reopening of the schools, they are, it's going to be a hot topic because they're going to have to do things right. Do the screening at the front door, the questions, the temperatures, the hand washing, the wearing universal mask wearing, and nobody could be closer than 6 feet apart. The ventilation systems, all the cleaning of the facility, airflow, windows open, doors open. The teachers are now very worried that if the kids are not getting extremely sick, they may get sick. So they don't want to go back to school or teaching school in person. They may do the Zoom and steal the kids in the classroom or something like that. So they are now trying some hybrid systems in which the kids are going to go to school only a couple of days a week, and different groups go different dates. So it's a very hot topic, and they're going to have to do it right. Otherwise, we're going to go back from phase 4 to phase 3, and soon enough to a full lockdown again.
And then I'm also hearing, Dr. Zambrano, that even when the vaccine is released, there might not be enough to go around. And apparently, there's not only one vaccine being tested. I hear there are 8 to 9 vaccines being tested. Why is that?
Yeah, so different groups having doing their own vaccine and trying different methods, and which is good because there's a lot of competition. There's a race now among the U.S., Canada, UK, Russia, and China. Everybody trying to develop their own vaccine, and we're gonna see which one is gonna be best. Less number of side effects and more protection, higher levels of IgG antibodies to protect us. So as we were hearing, the phase 3 studies just started last Monday. So more 30,000 patients are going to be injected Moderna in the United States with this vaccine, and that's going to be placebo controlled. So half of the patients are going to get the vaccine, and the another half, the other half is going to get the placebo. So we don't know exactly how it's going to happen in the large population, how safe it is going to be, and how effective in help us develop antibodies, and then once it is ready, how long is it going to take for everybody to get vaccinated? Some people don't want to go first because they're afraid of, of the side effects, or and some others are absolutely reluctant to know anything about vaccines. They don't think they work. So I don't think we're going to see the purpose of the vaccines is to get to a 60 to 70% levels of immunity among the population. We call herd, HERN, immunity. So once most people have antibodies to any virus, the virus is going to die off because it's not going to be able to spread around. No one is going to be susceptible. So the only way we can control this is through vaccination. So 60 to 70% of the population is immune, because doing it through getting the people infected with the virus, it's gonna cause too much mortality. It's gonna overwhelm the healthcare system, and the amount of money and resources and the economy is gonna crash.
Wow, Dr. Zambrano, you are so enlightened. I love that. I'm learning a lot from you tonight. So, viewers, don't go anywhere. We're gonna take a little break and we'll be right back.
Thank you.
Hello, Dr. Amina. How be?
Adeo, Adam, how be you too?
How we go do At the cause sake of the other time you talk say you go explain the vaccines thing give me.
Oh yeah, so everybody get immune system which they protect we from infections, right? Take say the body be house. The immune system be the house security, where viruses be arm robbers. If arm robbers come the house, where the security no make ready for them then yawa. So vaccines be what they train the security to recognize and fight these robbers if them come the house inside. Vaccines there, we start to use no be today oh. If the vaccines help we fight the 6 childhood killer diseases safe.
So why people they talk say vaccines no good?
Abi, I tell you say it no be true. Vaccines be safe, wah. Some people they react badly to vaccines, but that be rare, cry.
Oh, for real? I never know say them be safe like that. But why them still no get corona vaccine?
Charlie Adam, making vaccines and medicines no be easy. It no day like tea bread where them they take one day do It they take time to make vaccines. Sometimes yes safe. This be because them for do plenty tests make sure say it a job. Where it be safe too.
But if it take years, why them say the corona one day we figure time soon?
Righty, research advance wow. So we go fit develop vaccines in much shorter time. Also, sake of corona make pandemic, everybody they put in extra work to get vaccine.
So why them won't try the corona vaccine for only Africans wanna talk?
The French doctors them talk that thing there. Them no force cry. Where what them talk self no be true. Vaccine trials they go on for UK, Yankee, and other places. Sake of how corona spread, it be best to test the vaccines for every continent. Otherwise, we no gonna know if it go work give we. In any case, wanna FDA for approve all trials before we go fit participate. So one thing we for do be say, we for make wanna leaders do due diligence before them go accept anything.
Hey, Dr. Amina, me too so I'm sorry. You make about this vaccine thing, pow.
Adam, a day for you. I be you the kai how you go protect your body from corona.
Oh yeah, at the Kaiwa, I will stay house if I don't get anywhere go. I will wear mask if I come out, wash and sanitize my hands and other surfaces, and I will try to stay 6 feet away from other people.
Hi, my name is Ochiame Kwame the Rap Doctor. Coronavirus is a stubborn one, and because of this small virus, the whole world is on lockdown. But hey, hope is not lost. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctors. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they will give you an amazing discount. Mobile doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Hello, everyone. Again, this is Empressmawu on the health segment on Trend Africa TV. Right now, I would like to acknowledge some people watching us. We have DJ Teddy Melody. He says, thank you. Daniel Kwame, he says, yes, sir, you are right. St. John says, God bless you guys with your educative programs. Viewers, please go ahead and continue to share and invite your friends and loved ones to get educated on COVID the way forward. Dr. Ofori, I know Dr. Zambrano has had a very long day. He's probably just getting off work. And so we are not going to hold him for too long. But do you have any more questions to ask him before I let him give us his closing remarks?
Yeah, so I would like to thank him very much for giving us this insightful knowledge, and I mean I don't have much questions to ask him than to say that we would like to in the future probably we might have to ask him to come back one more time for our program, but thank you very much once
No
more
problem.
time.
It'll be my pleasure. Anytime.
Dr.
Sure.
Zambrano,
Appreciate
I'm
you guys
going to
having me.
put you on the spot and ask you, do you promise to come back when we talk again?
I'm gonna have to. I have no choice. I'll be more than happy. I enjoy. I had a lot of fun. I also learned a lot, and all the videos were great. So
Yeah.
so much to learn. Yeah.
Thank you so much. So any closing advice for our viewers before you leave?
No, I mean just to continue doing what you're doing. It's spreading the word and education about how we all. I mean, it is about all of us. It's not about a single person. It's about our community. We need to do this right and prevent more people from getting sick and some of them dying. We need to do a lot better job.
Yes. Yes. Dr. Zambrano, can you say Trend Africa, redefining Africa?
Say it again. What need to say?
You have to say Trend Africa, redefining Africa.
Trend Africa, redefining Africa.
Good. That's the best online TV. So I want you to like and subscribe to our channel, okay?
Okay.
We love you so much. Have
Sounds
a good
good. Thank you.
Thank you.
Thank you very much. I really appreciate it.
Thank you.
Have fun. Good night.
So Dr. Ofori, what should we be talking about now? What haven't we addressed?
Yes, so absolutely, we did have a very good section with Dr. Zambrano. So there's a difference between clinicians, people who are actually on the field treating patients,
Okay.
and also understanding how the virus is transmitting from one person to the other. Why is it that affecting different classes of people and so forth and so on? I think the conversation now is treatment. We now know that the disease is here, right? So the conversation that we should be driving at is how are we going to get out of this mess? And part of it is that we know that masks do fantastic job at reducing the transmission rate. So we encourage people to keep on doing it. There's even talks about very soon people are thinking about wearing, eye protection and things like that, because we're realizing that there's ways to prevent the infection from spreading. In addition, if we are lucky, by the end of the year or maybe sometimes early next year, we should have a vaccine in place that will reduce or give us some kind of a herd immunity and give the people or people who are susceptible to infection some kind of coverage. So these are the things that are in the line, but until we get a vaccine, I think what we need to stress most on is prevention, which comes at it's not an easy cost, I should say, but you have to be deliberate and be conscious and not kind of relax, because that's what is happening. We are relaxing, and because of that, the coronavirus is still out there and is going up. The numbers are keep rising, and the more numbers you have, the higher the chances that people are going to get severe cases, and we're going to have casualties. Yeah.
So have you heard about the high viral load in children and how they are the ones more likely to be spreading the virus now? Did you hear about that argument or study on CNN a few days ago?
Yes, and it's so many things coming up, with this particular disease. Every day there's something different that we are learning about the disease. Someone told me that after the whole pandemic is over, we're going to find out so much that we will be like, wow, because there's so much data and so much information in different pockets. And one of it is with how children are transmitting the infection. We do know that they are below certain age. I believe, the transmission is lower, and older kids, like those in the teens, the transmission is higher, and things like that. So that is influencing the argument about opening up schools, right? Because the whole thing is, if children are not getting sick, right, why don't we just let them go to school? But you and I know that when it comes to flu, we always tend to have the kids bringing out the flu to the house, right?
Yes.
And therefore, the fear is that it's because of the way highly transmittable this infection is, we're going to see a similar trend. And we are in August already, right? And very soon, flu season will be here. And like Dr. Zambrana said, if you have those two, we are in deep trouble. And therefore, I think that study that came out is a very valuable information to tell us whether we should let our kids go to school or not.
Right. So are we heading for trouble when school opens in a few weeks? How are the children going to understand how to cover their noses and wash their hands?
Right.
That is one.
The practicality portion of it is going to be very difficult to enforce, right? So it's better to do something than nothing. Pretty much, that's what we are trying to say. So they will put in place, like I teach in a tertiary institution, and we're doing most of our teaching online, just to cut down on that possibility of actually spreading the infection. So there was a company that tried to test every person in the workplace, right? And it was impossible. So guess what they started doing? They started testing the workplace itself. They tested people's computers and things like that, and they were able to find out that some of the workers actually had a virus. So we're gonna go in different directions. People are even investigating using dogs to be able to detect if someone has a coronavirus. So we're going in different directions, and I think that will influence the direction that we're going to go when it comes to reopening. But I understand, if you have 5 kids at home, it's not an easy thing to have all of them at home eating all your food, and you have no break. So it's interesting, but we should be thankful for teachers as well in this instance, right? We acknowledge how good it is to have somewhere to have your kids good to go. Yeah.
So another argument I heard the other time, a few days ago, was that with the pneumonia vaccine, when you take it, it covers you for 5 years. So they're now finding out if they find a vaccine for the coronavirus, how long is it going to protect us? Is it going to be 1 year? Like, the flu season is yearly. The pneumonia vaccine every 5 years. Have you heard about how long maybe it will take to be protecting us?
Yeah. So the short answer is a no, we don't. Because this is novel, and we are even seeing that some patients who had antibodies, after some time they're losing the antibodies, right? So we are not sure, but based on what we saw with SARS and MERS, we think that it will take years, and by then the hope is that we wouldn't have any person-to-person spread, and the virus will kind of go into, I would say, extinction, right? So that is the hope that we have, like we did with other outbreaks like MERS and SARS virus. So it will go away because we have immunity against it, and it's not community spread as we have it now. So we don't know how long it will be.
So when the vaccine finally comes out, are you going to be one of the people to?
Yep, I'm a pro vaccine, and I'll take it because I mean, there are several things that we will learn as a result of that, but we're just following science, right? And we've already identified that we don't have any other weapon to treat this infection than some kind of immunity, right? So far, those who have gotten infected, we don't see them getting reinfection, right? So if I have a vaccine that is stimulating my immune system to give me the antibodies, I'm confident that it will offer some protection against the virus as well. So I'll even if I had the option, I would have volunteered to be on the clinical trials. So I'll be the one. Yeah.
I don't know if your wife would like to hear that.
Yeah, that's okay. She believes in science too. I think she'll be part of us going over there to get a first shot. And besides, it's an RNA vaccine. It's never been tried, and I understand people are worried about vaccines in general. But
Right.
I think this is going to be one of the safest. Because I mean, the only issue we had with RNA vaccines was delivery. Pretty much, that's it. So if this company has been able to come out with a way to deliver it and have the expression going on, I have a strong feeling that it will be successful.
But why do we have so much mistrust for the scientists? Why don't we trust, especially we the Africans? Why don't we trust science? We'll rather trust the man of God than research and science. Why is that? What's wrong with us?
Yeah, so it's not like anything wrong with us, but I think the issue is the conversation, right? So I think after COVID, the conversation is going to be shaped different, right? So this is me in a lab. I come up with something. The person that I'm going to give it to has no idea what it is, right? We never involve the lay person in the conversation, and therefore it makes it finding a vaccine and vaccination two different things, right? So we spend billions of dollars making a vaccine, right? But then now we have to spend another $1 billion educating the people or convincing people to get the vaccine,
Right.
because we didn't involve them in the conversation. You need to understand what a vaccine is, and the fact that it's not meant to hurt you. We actually have some great success with vaccines in the past. The reason why a lot of us are alive today is because we got vaccinated, right? But unfortunately, along the line, there was some science published somewhere that said that vaccines actually caused what do you call it? It caused a whole lot of diseases, and
Like,
it's not a good thing. Say it again.
like autism.
Yeah, autism or mental illnesses,
Right.
and it's not the truth about you see, we are having the same issue with this lady, Manuel, going online and she going viral, right?
Right.
Right. But we forgot about the positive things that vaccines did. If you look at the graph of life expectancy over the years, over 100 years, when we had vaccines, actually the life expectancy went up, right? There were a lot of kids in Africa that were dying like few months after their birth because of some of these diseases, polio, measles, all these smallpox, right? We had more success story to tell than bad stories. But unfortunately, we are humans. We tend to gravitate towards when something doesn't go well. In America, unfortunately, there was a bad incident with science because of the Tuskegee study. So I understand there's an iffy part of it, but that doesn't take away the good side of science. And I will go with that because when you're sick, you know how it feels, right?
Yeah.
And when you get treated with medicines, you know how good it feels to have medicines. So we shouldn't be quick to crush it. We should in other words, we should look at the positive side of science as well.
So, as healthcare workers, what will be our role when the vaccine comes out? What should we be doing? You, GNC, you and Mrs. Eunice Cromwell, you're collaborating with Trend Africa TV,
Yeah.
and we are bringing this education to the
Yeah.
community. What as healthcare workers or as frontliners, what do you think we can come up with to encourage our community to come out and get the vaccine?
Yeah. Eunice, are you on there? Maybe you want to help me out here.
I'm sorry, I'm here. Would you please repeat the question?
So I'm asking Ghana National Council, Dr. Ofori, Trend Africa TV, we have all collaborated and we are educating the community about COVID and the way forward. So when the vaccine finally comes out, as frontliners, what should be our responsibility? What role can we play to encourage people to come out in the...
You know what? That's a very good question. And I think what Dr. Ofori said by him just announcing that he is pro-vaccine and advocating it, I think that is what we can do. We can encourage others by, posting and letting them know that we went and got the vaccine. and we haven't had any side effects, or hopefully it's only mild side effects, but we will be telling people our experience. So I, for one, am pro-vaccine as well. And being a healthcare worker, one thing that is good for us is that I learned that when the vaccine does come out, it's going to be first offered to healthcare workers and frontline workers and all those people. So we're first in line. So I think that the three of us need to go on one day, get our vaccine, and then make a video and say, "Hey, Chicago, we've got our vaccine." I think that'd be the best thing we can do to help promote the cause. I mean, our program is the way forward, and that is the way forward.
Right. So, Mrs. Cromwell, is there any issue we should address that we haven't?
No, this show was so enlightening. I was so moved by the doctor that was invited from an infectious disease. He really showed a lot of light, and I'm just very proud of the progress of this. I'll just encourage our viewers, if there's anything that you still don't understand about COVID-19, it's a great time to put your comments there so we can try to answer. If there's a specialty or a guest that you would like to see on the show too, please just put it there so we can try our best, because we're all living through this. We're learning about the disease every day. And I think that we've done a very good job shining light on every specialty and how it will affect our lives. So I'm very, very encouraged. And I just encourage our viewers to please get involved, be educated. Don't follow what you see on WhatsApp and share stuff that's not based by science. When you want to know, when you want a good COVID-19 update, please tune in every other Thursday so we can talk about it, dive into it, dissect it, and really get a clear understanding as to what we're doing.
Anyway, I would like to congratulate you and the GNC for putting up a very successful virtual concert last Saturday. I was there and it was so wonderful. Congratulations to you guys.
Thank you so much. We are so happy. We're so humbled and excited that even though the COVID-19 is going on, we were still able to, have our Ghana Fest and be able to showcase our culture. So we are very excited, and we know that the future is bright, and who knows when we'll be able to go to the park again. So we're happy that everybody was able to tune in and listen to some beautiful music and just see what Ghana Fest would have been at the park. So it's very, very nice.
Right. Okay, viewers, we'll take a little break right now, and when we come back, we'll get their closing remarks, and then we'll call it a night. We'll be right back. Don't touch that dial.
It's here for me, Chiamo, God's afternoon. Yes, fellow Ghanaians, this is a public service announcement. No need to get excited. Your watch it stays the same. It's in the brown box now. Look at it right there in the green leaf. Beyonce sign. Why? Mamunsru. Yep, rocks watch it. The watch it in a jar, that's a specialist. Jar, you see, yep. We got a huge contract. This is for hotels and folks from out of town. Yep. Environmentally friendly, stays hot. I got to plastic. I gotta go. But this is not for you. I mean, you got a choice, but your choice, your watch it stays the same. It's rocks watch it. The original is there. In the second demo. Yep. Powder for so. Hey, who's that? Anyway, we open right now. It's lunchtime. The number to call is 0244-676742, 0244-797911. Rocks watch it to the world. Catch them and see if find the World Cup. Yes, yeah. Do be able to.
Are you looking for photography service for your upcoming event? Is it a wedding, an engagement, or a special event? Look no further. Jojo Texan Images is here. Hire him today for great quality pictures, a quality service provided on the day, and a great personality. Jojo Texan Images is on social media. Follow him Instagram and Facebook at Jojo Texan Images, or call him 312-450-5235 and book your appointments today. Jojo Texan Images. Simply excellent. Book him now.
Hello, everyone, and welcome to the health segment on Trend Africa TV. I am Empress Mousy, and we have come to the end of this show. However, I'm going to give the platform to my co-host so that they give us their closing remarks, and I'll start with Mrs. Eunice Cromwell. Could you please give us your closing remarks?
Sure. I just want to say that I'm very grateful for being on this platform. And I just pray that everybody will continue to be safe. Please don't follow what other people are doing. Make sure that you are practicing social distancing. You are washing your hands. You are using hand sanitizer so you can remain safe. And I will encourage all of us, if you do develop any symptoms that you're not sure about, please contact your primary care provider. Also, be advised that there are a lot of testing sites in the Chicagoland area that you can go get tested for free, just drive through. So make sure that you are staying on top of your health. Contact the CDC or look online on the CDC if you have any questions or concerns. We can also be reached at any time. You can always send a message through Messenger, and we'll be able to answer your questions or your concerns. So I'm just very grateful, and I thank God for how far He has taken us all. And if we just continue to be consistent and we continue to practice social distancing, this too shall pass. So, good night to everyone. Have a wonderful night, and thank you once again for tuning in.
Thank you, Mrs. Eunice Cromwell. That is also the business manager of the Ghana National Council. Dr. Ofori, are you there?
Yes, I'm here.
Yes, can you please
Yeah,
give us?
sure. So, in addition to what Eunice said, I would like to encourage our listeners to be very cautious and be careful what information that we get and how we assimilate it and follow it. There's a lot of misinformation out there, and therefore, if you really want good information, tune in every other week, every other Thursday to listen to our show. And if you do have any questions, like she rightly said, send us a message, and we're going to attend to it. So, in addition to that, what I will say is that we should make sure that we wear our mask, socially distance, eat well, especially exercise, and make sure that we are healthy, so that even when we get exposed, we will not have a very bad outcome of this infection. Also, if you have any kind of chronic disease or any kind of hypertension, diabetes, or anything like that, make sure that you still go to your primary physician and have that under control, because we've realized that individuals with these diseases tend not to do well with COVID-19. So with that much I would like to express my sincere gratitude to everyone that tuned in, and also for Dr. Zembrano for showing up today and giving us very valuable information. So thank you. Until then, see you next 2 weeks.
Thank you, Dr. Ofori. Have a good night. Yes, viewers, this is Empress Mousy again on the health segment on Trend Africa TV. I would like to acknowledge some viewers. If I don't, they will kill me after the show. So I'm going to acknowledge my auntie, Bernice Carlton Senayet, Dr. Bernice Carlton Senayet. Sarah Bruce Duncan, thanks for the reminder, Empress Mousy. Oba Ekia Najimbi, thanks for watching. Belinda Ann, thanks for joining us and watching. Sarah Duncan says, vaccine, I suggest that we encourage the community to bring out the questions. You have done a great job educating the community. Thank you so much, Sarah. We love you so much for all your support. And Mr. Bennett Biney is joining us now. Mr. Bennett, I don't know where you were, but you are joining us at the end of the show. We still love you, and we'll talk behind the scenes. Okay, viewers, this is the opportunity for you to use Trend Africa to advertise your small businesses or your big businesses. Get in touch with us, and then we'll discuss how we can collaborate a little commercial for your businesses. All you have to do is email us on trendafricatv@gmail.com, or you can just follow us on YouTube, subscribe on YouTube, and follow us on Instagram. We want to thank our sponsors, which are Omama TV, Holiday Africa TV, Powerhouse Media and Restaurants, Akese Styles, Meduse Designs, Ojinuhu Designs, and the Ghana National Council. Thank you so much, everyone. Remember to stay safe out there. Do not trust what people are saying out there. Just go with the CDC, and then the WHO, whatever they put out there. They are more. I mean, their information is more creditable than anyone just springing up on social media and making very strong claims without backing evidence. So it is your own personal responsibility to take care of yourself. So for now, I'm just gonna say good night, and I'm gonna see you guys in 2 weeks. Good night.
Hello, Dr. Amina. How be?
Adeo, Adam, how be you too?
How we go do am? At the course sake of the other time you talk, say you go explain the vaccines thing give me.
Oh yeah, so everybody get immune system which they protect we from infections, right? Take am say the body be house. The immune system be the house security, where viruses be arm robbers. If arm robbers come the house, where the security no make ready for them then yawa. So vaccines be what they train the security to recognize and fight these robbers if them come the house inside. Vaccines there, we start to use no be today oh. If the vaccines help we fight the 6 childhood killer diseases safe.
So why put the talk say vaccines no good?
Abi, I tell you say it no be true. Vaccines be safe, wah. Some people they react badly to vaccines, but that be rare, cry.
Oh, for real? I never know say them be safe like that. But why them still no get corona vaccine?
Charlie Adam, making vaccines and medicines no be easy. It no day like tea bread where them they take one day do It they take time to make vaccines. Sometimes yes safe. This be because them for do plenty tests make sure say it a job. Where it be safe too.
But if it take years, why them say the corona one day we figure time soon?
Righty, research advance, wow. So we go fit develop vaccines in much shorter time. Also, sake of corona make pandemic, everybody they put in extra work to get vaccine.
So why them won't try the corona vaccine for only Africans wanna talk?
The French doctors them talk that thing there. Them no force cry. Where what them talk self no be true. Vaccine trials they go on for UK, Yankee, and other places. Sake of how corona spread, it be best to test the vaccines for every continent. Otherwise, we no go know if it go work give we. In any case, wanna FDA for approve all trials before we go fit participate. So one thing we for do be say, we for make wanna leaders do due diligence before them go accept anything.
Hey, Dr. Amina, I'm sorry. You make about this vaccine thing, pow.
Adam, a day for you. I be you the kai how you go protect your body from corona.
Oh yeah, at the Kaiwa, I go stay house if I don't get anywhere go. I will wear mask if I come out, wash and sanitize my hands and other surfaces, and I will try to stay 6 feet away from other people.
Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, a virus. A chewa, you go lost. Wash your hand daily with running water and don't stop. Keep away from non-family meetings and do something, bro. Pray for your enemy, pray for your family, pray for your country, yeah. Don't forget to keep clean with hand sanitizer. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, a virus. A chewa, we go lost. China, Japan, man down. Italy, UK, man down. United States locked down. What now? Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, a virus. A chewa, we go lost. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus, mania, and it's serious. Corona, yeah, virus, yeah, chewa, we go lost.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.